This is the Fix Your Sciatica podcast. So let's talk about combat sports. I myself am a participant in Brazilian Jiu-Jitsu, a lot of groundwork. A little over a year and a half ago, started to have the opportunity to talk a little bit more about injuries in the Jiu-Jitsu world, grappling world. And today's guest is an amazing guest because he is a black belt and a physical therapist. He's been posting a ton of really helpful content when it comes to overcoming injuries, especially as a combat athlete. And after having a few conversations with you listeners, I thought that he would be a fantastic guest to be able to shed some more light on what it's like when dealing with injuries as a combat athlete, especially in jiu-jitsu. So today I have Dr. Michael Piekarski he's just the man, and his Instagram handle is Dr. Kickass. And I've been following him for a while, and he was kind enough to share some of his knowledge with us. So Mike, great to see you. Thank you so much for being on today's episode.
Thanks for having me on.
Yeah. So let's get into it. Let's talk about you for the listeners who may not have come across your information just yet. Tell us a little bit more about yourself and how you got started and where you're at today.
Sure. So I started jiu-jitsu in college. It was like it was a little club. We had literally I was learning from a white belt. I'm surprised we're not all crippled. So I graduated college and I really didn't know what I wanted to do. I had a bachelor's degree in psychology and history. So I was just doing working in an office. And in the meantime, then I found a coach so I started taking jiu-jitsu more seriously. He started to fight. I ended up being one of his main training partners. Randomly, one time he said, have you ever thought about fighting? And it was like something that never crossed my mind. I was a very unathletic kid growing up. I wasn't able to I played sports as a kid, but I didn't really get past like middle school. So I still was pretty unathletic. So it wasn't something that I really thought I could do. So I started training for fights. I had a few Muay Thai fights. I had a few MMA fights. So after my pro debut, I remember I got paid $500 and I broke my nose. I was like, you know what? This probably is not a good long-term life strategy. So I'm like, well, what else do I want to do? So I was trying to think, what could I do while also doing jiu-jitsu? So I looked into personal training. The problem is at the time I didn't have that personality of like being like a salesman where you have to like sell packages and all that stuff. I'd never trained other than teaching jiu-jitsu. I'd never done any physical training. So I wouldn't have been a good personal trainer anyway. I'm looking for jobs. I see something called a physical therapy assistant. I didn't know that that's its own degree and license. I started applying for jobs, and then I realized you need advanced schooling for this. So I remember I was sitting in for all people who don't know, if you want to be a physical therapist, you have to do at least 100 hours of like volunteer. I think for PTAs, for assistants, it's like 15. So I was like, all right, well, I'll sit in. So I'm at a PT clinic and I was like, I think I could do this. And then whoever I was sitting with you already have a bachelor's degree. You might as well just get the doctorate. And, I was not keen on accumulating all sorts of debt, but I also didn't like the idea of like having to listen to somebody else. So I was like, all right, I'm going to go to PT school. And so I didn't really think that I was going to be able to merge the two, like PT and jiu-jitsu. It was something that I felt like there was like kind of like a loose connection. And, after PT school, I started, I kept training. I became a black belt. And then I realized that, I'm training with these people and then they start coming to see me. I'm like, oh, wow, I can actually start to try to merge this practice and be kind of like this niche physical therapist that really works with martial artists. That's kind of how everything kind of came together.
What an awesome journey. Yeah. To be able to go from being we'll say a competitor in the sport, yeah, and then figuring out, okay, well, what are the next steps to be able to take that into your career? It's awesome. And so I've interviewed experts in other sports and activities, and we discussed actually some common reasons as to why an athlete can actually get injured, and specifically sciatica and low back pain. And so from the athletes that you worked with, what causes have you actually seen in, like they said, the BJJ world? And we can also migrate into combat sports in regards to low back pain and sciatica. Like, what were some of the common causes that you would see of which they would say, all right, I got to see you, Dr. Mike?
Yeah. So I guess, because I know not all your listeners are, medical professionals. So just in case. So we could take sciatica, which is usually what people say that they have radiating symptoms down your leg. So we could say, what is the cause? Is that from a lumbar radiculopathy? So is a nerve getting pinched somewhere inside the nerve, herniated disc, etc.? Or is it a peripheral nerve entrapment that kind of like goes through the sciatic nerve, which is sciatica? So just, obviously, because those are slightly different things. So if you look into the research on jiu-jitsu injuries, most papers that I've seen are focused on extremities. So like, okay, well, how are people getting hurt relating to like an arm bar or a knee bar? So a lot of times they actually like don't include spine injuries, at least for competition, because you have to think about it from like the only spine lock is going to be a twister, which is like a rotational movement, a forced rotational movement. So it's like it's not a common move. So there's not a lot of like back submissions. So most of the injuries that I see are going to happen in training. But again, because there isn't a lot of back submissions, it tends to be more of like an overuse. So it isn't like one instance where, oh, I did this and I started having issues. Now that can happen because unfortunately, you look at the demands of jiu-jitsu. In jiu-jitsu, you're going to see extreme spine flexion. The reason why is anytime you're using the guard, so when you're playing the guard, you're on your back, every time your knees are coming to your chest, there's going to be some level of lumbar flexion. And again, it's not just you unweighted bringing your knees to your chest. You're using your legs to keep someone away. So whether you're creating space so that you can get back to your feet, whether you're creating space to prevent them from passing to like a side control pin, you're using your legs. So it's like you're resisting their full body weight. So it's like your full body weight in either a partial range lumbar flexion movement or sometimes even an end range movement. And then you can think that there's like certain maneuvers, which is called inverting. So as someone's trying to clear your legs to get chest to chest, you could do a move called inversion where you kind of like roll in a certain way, which again, it's based on spine flexion. So you're kind of, if you do it correctly, you don't really hang out there. But again, there's a moment where you're upside down and someone's full body weight's laying on top of you. We can look at a position called the stack. So if let's say someone's, in closed guard and I'm passing, what I can do is opposed to going around the legs, I can literally just kind of like roll them all the way up so their hips are overhead. So it's such an uncomfortable position, they let me pass, which for them, again, we're putting them in this extreme lumbar flex position. So just the amount of guard you're going to see, we're just dealing with a lot of spine flexion. You also can think of like when it comes to takedowns. So jiu-jitsu practitioners are generally not as adept at takedowns as like other martial arts like judo or wrestler. So you're going to see a lot of people that are just going to be doing like shooting for kind of like sloppy takedowns. So a lot of times, as opposed to in wrestling where you're kind of like bent over at the knee, you see in jiu-jitsu, a lot of guys are going to be bent more at the hip. And again, their postures might not be great. So now they're going to be like some level of lumbar flexion. You shoot for the legs. So essentially what you're trying to do is you're trying to like grab someone's leg to pick them up. So if you have bad body mechanics, you're lifting with kind of like, like lifting with your back, which is again, a loaded lumbar flexion motion. So those are some of the demands in grappling that you're going to see. And those are also the mechanisms where I'm going to see someone getting injured. And again, it might not be like one instance where someone gets stacked once. It could be just that accumulation of over and over and over again. And eventually people start having, back pain. And generally, even though what makes jiu-jitsu very fascinating is it's not a sport where you only see people in their 20s. Like you can see people in their 30s or their 40s who both compete and do it as a hobby. But I still would kind of like lump them in from like a medical professional standpoint that we're dealing with more like an acute athletic back pain. Like they tend to have like more segmental instability than like as people age and they're in their 50s or the 60s where they might have stenosis. Now, a lot of these jiu-jitsu athletes might be going the way to eventually have stenosis, but they're usually not there when I'm working with them.
This episode is brought to you by the Patient Advocate Program. Are you tired of not having support between your rehab sessions? Introducing the Patient Advocate Program, and we're focused on your recovery, and we're offering you 24/7 access to a doctorate of physical therapy. Stop waiting in line to be seen and stop spending hours doing long exercise programs. Imagine being able to get all of your care delivered straight to your phone. Best of all, it's affordable. We believe everyone deserves top-notch relief without breaking the bank. So why wait? Take control of your health today and visit ptpatientadvocate.com and book your free call with our experts. That makes perfect sense. And so you brought up there's three big highlights that I wrote down, and it was like questions that were popping up as you were describing this, but then it got answered eventually. I was like, one, seems that mostly it was like an accumulation of stresses, an accumulation of stimuli over a period of time, whether it be over subsequent training sessions. And we'll go into a little bit more later on in this conversation about like, are we trying to like being able to differentiate the stresses that we accumulate in life in general versus the stresses that we accumulate in training. And then you also, as you said, you see it mostly, the research has shown mostly in competition and maybe not as much in training. And then the third piece was this concept of a lot of spinal flexion, end range spinal flexion, loaded spinal flexion. And I think what's really interesting with that is there was a period of time, probably within, we'll say from 2006 to 2017, where the McKenzie method and back extensions and never flexed your spine took a huge movement. There was like that period of time where it said, oh my gosh, you should never flex at your back. And what was really interesting is that it started to evolve to get into actually, no, flexion is actually okay. And there's a lot of professionals such as yourself, a couple other PTs and chiropractors are saying, actually, if we do graded exposure, but also exposure under the right conditions of spinal flexion is a key. So when it comes to being able to safely accumulate and recover from spinal flexion movement, say something like when you are getting stacked in a guard, what are some of those strategies in which people and jiu-jitsu athletes can stay healthy because they are in fact going to be put in that flex position for a long period of time?
Yeah. So, and obviously I can talk about how my rehab has changed because I remember that period that you're talking about. And so I wasn't doing like, this is like an evolution of practice, right? But we can kind of come back to that. But if let's say I'm working with a jiu-jitsu athlete, so there's no position that are inherently more dangerous. It's, does that person have the joint prerequisites to do that movement? So again, there's a lot of people as they age and say, hey, inverting, that's not good for your back, which is, I mean, again, it can be dangerous for the wrong person, but if the right person should be able to do it. And then again, for competition, it could be a good tool because it's, it's a good defensive movement. It's a good way to escape. You can get into different leg attacks. So again, it's a tool that can be used, but not everyone has that ability. So usually when I'm working with an athlete, we can break it up into both global movements and then segmental movements. So first is I want to make sure that they have enough global spine movement, and we can take the spine, and the spine is not one joint, is every vertebrae is its own joint. So the thoracic spine is 12 vertebrae, and then the lumbar spine is 5, and then the sacrum is like a fused joint. So there's a whole bunch of joints. So first we have to make sure that someone has enough global motion in every plane of motion, because the spine can flex, it can extend, it can rotate, and it can side bend. So I want to make sure that they have that. So we can like put it, we can measure it, but obviously what does a goniometric measurement mean to like a practitioner? But again, is I want to make sure that when they're doing some of these movements that maybe they're not quite at their end range. So they have a little bit of buffer, because you are going to be dangerous. It is going to be more dangerous if you're constantly riding that end range. But if you have a little bit of a buffer, it's going to be a little bit safer. And then we can look at segmental motion. So one of the things that I try to do, and I'm trying to find a lot of research on this, but like in research, one of the acute back injuries that happens is when people throw out their back, which, in research I've seen, one researcher describe this as a spinal buckle, where one segment is forced to move too far. Now, again, was that the one segment that has to move, or because a lot of times what happens is you might have a segment above and below that are stiff. So that one segment has to move. And, obviously you're a practitioner. That's why surgeons are doing fusions a little bit less. They're trying to use these alternatives, because if they fuse a joint, then people tend to need another fusion either above or below in about 5 years, because the motion's got to come somewhere. So trying to create that movement potential at every segment so that we don't blow out your back or blow out that segment. And then once someone has this global motion, where they have this segmental motion, then we can start to incorporate appropriate stresses. I like starting someone with an isometric, because an isometric, when done right, obviously it's like almost a subjective intensity, like how high can you go? A lot of times you see isometrics used in like rehab, and they're just like low level isometrics. I can ramp up my isometrics to like 100%. So it's the same difficulty as doing like a 1 rep max deadlift. Like, it's very challenging, but obviously I don't start someone there. We work our way up there.
Yeah. Great exposure. I mean, I'm glad you brought this, like the isometrics itself, because the reality with isometrics, if you look at the 3 types of muscular contractions, right? You have concentric, where the muscle's shortening. Yeah. If your muscle's shortening, you're actually generating movement. You're actually only able to create submaximal force, because of the fact that you're the one that's actually creating the shortening of it. Isometrics is actually resisting motion. So when you're resisting motion, you actually have the opportunity to reach your maximal levels of force. And then with the eccentric, when you're slowing the elongation, you're actually reaching the the supra maximal forces. And so I'm really glad that you brought that up, because I think a lot of people, when they think, the most common isometric that people know when it comes to trying to treat their back is a plank. And a lot of people would be like, oh, I'm going to try to hold this plank for like 2-3 minutes. The reality is that you can't like hold a maximal muscular contraction for 3 minutes. Like, that's not possible. Right. We tap into the other physiological systems. So I'm so glad you brought that up. And then, as you're going through this, it's like we have our global motions, we have our segmental motions, and I'm 100% in agreement with you, because we have to have everything like work as a functional unit, right? But then also we have to make sure that we take into account those various different segments. And I often see this a lot, especially when I'm working with people who have neck issues, because they might have like a super mobile, like C1, C2, but maybe like it's hypermobile because of the fact that they're not moving at their thoracic spine, not moving at their lower thoracic. We have this. And I love the fact that, as you said, you were like, we're talking about, like, I put this in a box. It was like prerequisites to be able to take on these various different challenges and stresses. So thank you so much for sharing that. That's really impactful stuff. So from there, right, if we're talking about like prerequisites, we have this mobility, we have this control, and then also, as you said, you're getting people into building up their isometric strength, their ability to resist motion. Let's talk about just some progressions that people can go through. So it's like, okay, someone gets hurt, and this can just be applied to just the general principles of recovering from an injury too, which can also be applied to sciatica and low back pain.
So generally, if someone's in the acute phase, I'm going to use like lower level intensities, and we can break it up to like 20, 40, 60, 80, 100% effort. And what's interesting in jiu-jitsu is a lot of times when I'm teaching people isometric ramping, it's actually very similar to applying a choke. So let's say I apply a rear naked choke. I don't just kind of like squeeze as hard as I can, and because I'm going to burn my arms out. And anyone who's done jiu-jitsu, it's like the worst feeling in the world. You squeeze as hard as you can, and your arms burn out before they tap. So now you can't, and they escape. And you're like, I should have, submitted that person. So when I'm applying a choke, I'm slowly ramping up. I'm going 20, 40, and really around 40, that's when they're tapping or they go to sleep. Because we know it takes about 9 to 10 seconds for someone to go to sleep. So that slow ramp, we can use that same thing for any type of isometric that I use. So I kind of slowly ramp someone up just so they kind of understand what I'm talking about. So I do my assessment. I see wherever someone's lacking. I first see where they might have hinge points. So areas where they have that hypermobility or those areas of hypomobility. But let's say I'm working on global motion. So I might do like if let's say someone's in an acute injury, I might not jump them to my end range. I might working in their mid range. But I'm going to do like a lower 20% effort. But we know that with low back pain, muscular endurance is more key, because our stabilizing muscles, our multifidi, they are, supposed to be fatigue resistant. So it doesn't matter how strong they are, because I have to make sure that they can stay strong long enough so our prime movers can move. So I would do, working upward towards a minute or more of an isometric hold if they can maintain it properly. Again, that's our goal. And as the intensity increases, the volume has to go down, because again, you can't kind of go increase the intensity and the volume. I might start working someone to more, now we're in their end range in whatever way. And chances are I would do something, I'd put them in a position where, they're kind of like bending over, they might be hugging their legs in a situation where like their hamstrings aren't a factor. Like, because if I bend down and touch my toes, I don't know if it's my hamstring or back that's the limiting factor. So I probably want their knees bent. And then this is a way that we can slowly start doing a mid-range to an end-range isometric. I can slowly, again, increase the intensity and then, kind of progress. I could start working on the volume too when it's appropriate. But again, it has to be lower intensity.
Yeah, we have to be able to change pretty much, in essence, like one variable at a time, right?
Yes.
Because of the fact that if we try to change two or increase two at the same time, we actually end up surpassing it. I love the fact that you said objectively slowly ramp them up, and the fact that you are, in fact, using percentages. I think that one of the challenges that people get, especially when the BJJ world, where they go and they're told by their doctor, okay, you can't train for a while, and then we'll say 6 weeks go by, patients heal, and they go back to the doctor, and the doctor's like, yeah, you can go back to jiu-jitsu, but like take it easy, right? And oftentimes taking it easy, like no one knows what that means. It's kind of, and so being able to say 10%, 20%, it allows us to be able to get a good, clear idea of what our progress is like, but actually truly measure the intensity, which I think is extremely important. And so going off of that, right? So we have this ramping up, we have the objective standpoint. I think you talked about this before, but for the folks, like when it comes to low back pain and sciatica, what are a couple of things that you look out for that helps you determine whether or not is it actually going to be a lumbar radiculopathy or is it going to be more of a peripheral neuropathy? What is the thought process that you go through that kind of helps you define what those two are?
Well, so first thing I try to do is if lumbar movement or spine movement can elicit symptoms, I'm thinking more radiculopathy. I could do some type of like PA spring, like I'm actually pushing on the spine. Does this create any symptoms? If I'm thinking radiculopathy, so again, we're thinking pain shooting down the leg. We also can look at some of their sensation. Is there sensation changes? Are there any type of deep tendon reflex changes? Is there any weakness? And then the key thing is like, can I provoke it? So and that's like the thing. It's interesting, which people don't want to know, but like the deep, dark secret of physical therapy is I'm almost trying to create your pain on my evaluation, because if I can create your pain, I know what your pain trigger is, then I have a better idea of what I'm doing, versus like a peripheral nerve entrapment. It might be like, I might be like actually palpating the piriformis or the sciatic and just doing a sustained hold. Does this actually create symptoms? We can do various tests, like, I could do a straight leg raise test where I can see, where the spine is the back is relatively neutral. And then the neck movement, again, if that creates movement, then that makes me think, okay, maybe this is a sciatic nerve or peripheral nerve entrapment. So, stuff like that. The slump test is a little bit funky just because the slump test, the back is still flexed.
So number one, when we are overcoming an injury, we have to figure out what is the source of that, especially when it comes to managing low back pain and sciatica. Because of the fact that if you Google sciatica pain right now, sciatica pain relief exercises, you're going to find programs that are probably going to have like 10 to 15 different stretches. And the 10 to 15 stretches, like you often see like the pigeon stretch, child's pose, downward, upward facing dog, and the cat cow. And those are all pretty useful stretches and positions, but each one of those actually will address a specific tissue in regards to what the challenge is. And especially, I think I have a lot of issues with, say, like the cat-cow, because of the fact that you're adding both flexion and extension. And if you have a disc that gets irritated with flexion, then the cat position is going to make it not feel to begin with. So I think it's important. Yeah, go ahead. Sorry.
And that's why, it's important. And obviously, you're a medical professional. Like, people need to go get assessed. Like, you can't just go online and just find like some program that's just because essentially they're like, well, we don't know what the issue is, so we'll just do a whole bunch of random stuff, which hopefully will hit the issue. But the problem is like again, let's say someone goes through this program and they're not guided. So now they might be irritating things in a different way. Like, the program didn't work. Well, 3 of the exercises might have been okay, but that one was problematic. So it's best. And also for me personally, we both know that home exercise program compliance isn't always the best. So if I'm giving someone like 8 exercises and 7 of them are garbage, but 1 is gold, I don't necessarily know if they're doing the one that they really need. They might be just doing all the other garbage exercises and like not getting anywhere.
Yeah, I noticed that for me as I've gotten older in my career, I went from early in my career, probably like 15 exercises until I was like deep into like, I have no idea what I was doing. I'm going to have everyone do everything to like a 25 exercise program. And now I literally tell my patients and the clients I work with, listen, at max 15 minutes a day. Like if you can find the right things, you can do that, and you gotta go back to living your life and addressing the lifestyle factors. And so let's talk about the concept of well, most of this stuff will usually happen during training. We talk about this accumulation of stresses. I think the question that comes to mind is, when it comes to the accumulation of stresses, do you think, or what you've seen, is it an accumulation of stresses that happens during the training sessions over time? Or is it that plus a combination of the stresses that we come in contact with in our everyday lives?
Yeah. I mean, I think it's probably both, right? Because, it's not like we're only stressed with jiu-jitsu. It's like life. So a lot of jiu-jitsu athletes, they might be lifting, or they might have, like sedentary jobs. They might be in an office. So they're sitting for 8 hours a day. And then they go do this like crazy flex, position in jiu-jitsu, and then they're going lifting with bad form. Like, there's always a lot of things, right? So ultimately our job as medical professionals is figure out all the possible stresses and how we might be able to mitigate it. So yeah, I definitely think it's an accumulation of life, not just jiu-jitsu.
And I love that. That's the same approach that I take, because realistically speaking, unless you're like a professional athlete and you're like, your main activity is this specific activity, you're going to have life come at you. You're going to be having to walk from place to place. You're going to have to drive. You're going to have to sit. And I like to think about it as like, I started off my fitness career because I was a college athlete myself and retired, and I got into fitness and wellness and getting into CrossFit. And a lot of people are like, well, I sit all day. Yeah. And then I'm going to come to do this CrossFit class, which is an hour, very, very concentrated movement. I think that's going to be enough. Yeah. Right. So one, it was like, is the concept of enough. Then also number two, people end up getting hurt, and then they're being told, okay, you should stop doing said CrossFit activity. And oftentimes they're not saying, well, if you're sitting 8 hours a day, it would be a very good idea for you to be able to get up every hour, or even change your workstation, which allows you to have that variety of movement. And I think that's where a lot of people get misinformed, is the fact that they only look at said activity that hurt them. And I actually just recently spoke with a runner, and they were like, I got hurt while running. But we also looked at, well, can you touch your toes? Can you do all these other things? And they didn't. They didn't have the capacity to do so. Yeah. So when it comes to being able to work capacity, like flexion capacity specific, because you see that a lot in jiu-jitsu. What are some of the activities, like things that you would recommend? So like flexion, which is forward bending. So when you're saying like great exposure, is it simply bending forward and touching your toes? Like what are some of those examples of great exposure into flexion to help people build their capacity into forward bending?
So I like the cat-cow, but I'll kind of do a press, obviously with an asterisk. So the way that the cat-cow is normally taught is that people just kind of like flop up and down. So again, if they have hypermobility or hypomobility, we're not being specific. So a lot of times what I will do is I will try to create segmental motion, which if you have low back pain, we know that your ability to make segmental motion is going to be poor, but it's the intention. So like my cat-cow looks more like a spinal wave. And then there's different things that I can do to try to create more spinal awareness. Like I could do what's called a wall peel off, where I kind of like flatten my back against the wall, and I'm slowly trying to move one segment at a time. So what that does is that allows the wall, which is giving me tactile cue to kind of like block a segment. So I can kind of like peel one segment at a time. And again, if someone's ever done this before, it might not be like quite one segment, but it's likely going to be better than just moving in these like big movement chunks. I could do the same thing with like a segmental bridge. You kind of like do a glute bridge, and then you're trying to flex one segment at a time. So you're using the wall or the floor, to have that tactile manual cueing of going one segment at a time. So those are like 3 exercises that I would start to incorporate to try to make flexion more tolerable. A lot of times too, like when I do the wall peel off, I can actually build that into an isometric where I have someone, they flatten their back against the wall, they slowly start to peel. Oh, I get to this one segment, things hurt. That might be the position where I'm doing those isometrics, because we know that now we're at that one segment that's problem. So that could be that hypermobile segment. So now we want to try to do like kind of this motor retraining to strength training to endurance training, add that specific segment.
Yeah. When you're going through this, it actually helps people become even more aware of their positioning, of their movement. I think most oftentimes, and I've said this a lot in previous episodes, where one of the big things that separates us humans from animals is the fact that we're actually able to override a lot of those cues, and we're able to dissociate our minds from our body, which leads to us pushing human performance, right? But also, number 2, put ourselves in some positions where our bodies are saying, okay, we have enough. And so to be able to do something like this wall peel off, which I love, it's a great movement, to be able to say, all right, here's this movement that you are going to be a little bit more self-aware of. What is your body doing during this? And it gives all of us an opportunity to get back into our bodies, which in jiu-jitsu, like, you have no choice but to be within the moment, right? But there's so many other times throughout the day where we're out of our body, just like overriding those signals. So I'm so glad that you're really bringing that up. Yeah. So that's awesome, man. And so, all right. So we got this breakdown. Like, we have the lumbar radiculopathy, we have the peripheral neuropathies as well. And then really trying to see, okay, there's a lot of spinal flexion. This is how we can do some graded exposure. And also a way to prevent it or minimize it is to make sure that we are, in fact, very aware of our movement throughout the day, so that we're not just doing one more so than the other. For the BJJ athletes that are out there, people who are listening right now, who are dealing with low back pain and sciatica and stuff, let's talk about some action steps, right? Because we had the opportunity to talk some really good components of what's going on, but what would be, what are some of the actionable steps that they can take to take care of their bodies, especially when they're in this case? And I'm just going to say a funny story real quick. I remember telling my coach, I was like, well, how do I get out of this arm bar? And he said, well, the best way to get out of the arm bar is to not get caught of it in the first place, right? So, but once we're in there, right, once we're dealing with that, what are some of the actions that you recommend that people take?
Are you talking about like from a technical standpoint? Like, let's say someone's getting stacked, like how we can...
Really more so like for the people who are BJJ athletes right now and they're like, oh, my back hurts. Like what can they do? Like if they're listening, like, yeah, this hurts. Yeah.
So, I mean, first thing you got to do is I would recommend seeing some medical professionals so they can go through the assessment, just like we talked about. A lot of times people are unaware of how poorly their body moves until they're put in these isolated positions, because as you said, as athletes, we're always going to compensate. So like they can do something, but they might be doing it very suboptimally. So we can kind of see what does their isolated movement work, because if they have a very severe deficit and someone has to do a compound movement, that one area is not moving, so somewhere it's going to get overloaded. So that's a pretty common thing. You can pay attention to what positions are problematic. So like I've had people who they're like, I'm a competition athlete, I want to get back to inverting, my back hurts. Well, it's like, so obviously the lazy answer is like stop doing jiu-jitsu. The less lazy answer is stop inverting. But as opposed to saying what you can't do, why don't I give an athlete an opportunity of what they can do? So if you can't do this, what's a different strategy? So maybe, you don't invert, but what's a guard position that might be a little bit safer for your back? And I would say, why don't we try more of like a half guard or a knee shield, which is less spine flexion because we're on our side. So it might be something where they can do jiu-jitsu, but they're not getting constantly irritated because they're not just rolling over their back and just keep hurting themselves. Because again, like let's say even if you are working with your professional, right, and then you keep going to jiu-jitsu, you could be just keep irritating. And on the flip side, like let's say, like you said, you go to your doctor, and your doctor says stop jiu-jitsu for 6 weeks, which is just an arbitrary amount of time, which is pretty much the doctor's way of saying, I don't know how to help you, so let's just take rest, and the tissue hopefully will be healed within 6 weeks. But the problem is, is the injury isn't healed. The injury just stops hurting. And that's what, usually what happens is that people have a history of a bad back, or they have, I keep throwing out their back. Essentially what that is that's a chronic back injury with repeated acute flare-ups. One of the things that we see is, let's say someone hurts their back, what do? They stop moving. So now those spine segmentation muscles, they're just going to start to atrophy because they don't have to do anything. And it's interesting, if you looked in the literature, that what they found is that after a low back injury, your multifidi, which are your lumbar stabilizers, they start to atrophy, and then they fill in with these like fatty infiltrates. They actually, I have to figure out with the paper that I read that was talking about this, but the fiber content will change from a slow twitch to a fast twitch, which is bad if it's supposed to be a stabilizer, because we don't care if it's a fast twitch. So a lot of times people are like, I threw up my back and it's feeling better now. It's like, no, it's just not hurting. So that's where, again, I like doing, I found that spine segmentation is a good long-term spine health strategy. I think the problem is it's not going to be like 2 visits, I do some segmentation, and you're going to be magically better. It's something that you have to practice with. If you have back pain, the ability to make segmentation is going to be like pretty limited, so you're going to suck at it for a while. So that's something that I would do, is try to learn the spine segmentation, which is not a common thing. Like most rehab, as we discussed, are probably going to be more McKenzie or like McGill based. Like that's still pretty common, but that would be one thing that I would do, is try to see if you can start working on spine segmentation, because I think that is good for long-term spine health.
Yeah, I'm right there with you. And I love the fact that you said, like, you got to look at the positions that are problematic.
Yeah.
We take them out for now, but then if we were to reintroduce them in a safe way, right? Graded exposure.
Yeah.
Maybe like in some cases, people are doing things wrong. Interesting story. I had a client who was a purple belt in jiu-jitsu, and he said his shoulder hurt every time he posted up on his shoulder to like sit up. And I was like, okay, well, we got to look at you sitting up and see what you're doing. Yeah. Turns out that his shoulder was extremely internally rotated, put his shoulder in like a really compromised, a very inefficient position. Well, no kidding. That's why your shoulder's bothering you, right? Yeah. So being able to have that, and I love the fact that you said there's a difference between better and not hurting. And I think that's where a lot of people confuse that, where they're like, okay, I feel fine now. And then they go right into it, still going back into their same ways, still doing the same things. They didn't learn anything from the previous injury. And then they just go through that same vicious cycle. And so it's a really eye-opening experience, Mike. And so, I mean, this is all really insightful, Mike. This is really, really cool. I think the listeners out there who want to get back into training are going to take a lot of value into this. And now you work with both athletes and also physical therapists to actually improve their education. So for the folks who are listening, they're like, I want to listen to Dr. Piekarski a little bit more. What's the best way to get in touch with you?
Best way would be social media. My handle is Dr._Kickass. And, I try to use my, so like my Instagram is essentially just like educational content. Like I don't really post too much stuff about me, maybe a little bit. I'll use pictures, but for the most part, it's just trying to educate the martial art athlete, because I've been in a position where I did jiu-jitsu before I was a physical therapist, and like, I'd have an injury. I'm just praying it wasn't severe, and I was just that knucklehead that didn't know any better. I feel like jiu-jitsu athletes are probably like runners, where like their identity is so built into doing that activity, like the idea of not being able to do it, like, so people just keep training through these injuries and they keep getting worse. So anyway, that's kind of like what I talk about with my social media, and I do have like a few online programs too. So for physical therapists, I do have a continuing education course called Treating the Jiu-Jitsu Athlete, where I kind of talk about this into a wider, I just go into much more detail, where I talk about, well, like we look at the injury trends, like kind of like the unique injuries, kind of the return to sport idea, going from an acute injury, getting someone back to the mat. I include some movement milestones that I use, and this can be both for lower extremity, upper extremity, or the spine. So these are some of the things that I do, because essentially what gets me, what clears an athlete for me for sport is, can their injured joint do what it could do previously, and then how do they do with sport specific movements? So we kind of include that, and then I discuss like a great exposure from going from an injury to full competition. Well, what's the difference? And then for people who aren't medical professionals, I do have an online training called Kin Stretch for Jiu-Jitsu, which is kind of like my system of joint training. So Kin Stretch is a system called Functional Range Systems. I just took that and I'm applying it for Jiu-Jitsu. I have one for the lower extremity, I have one for the upper, and I'm hopefully going to finish my spine one by the end of this month, I'm hoping, where I kind of like go through where if like, let's say you're a jiu-jitsu athlete and you're interested in spine segmentation, I kind of go through some of the strategy that I use with my clients. So you can too kind of work on that spine segmentation.
Beautiful. Listeners, I'm going to take all that and I'm going to put it into the show notes. So if you didn't get a chance to write that down, I'll put those links in. Mike, thank you so much for your time today.
Yeah, thanks for having me.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.